Hey everyone, Dr. Gage here, bringing you a video today on 3 different classifications of pain or injury. And those 3 are based around timeline of events, okay? So the first one being acute, the second one being subacute, and the third one being chronic, okay? Now with chronic injuries, that's something that's been going on for months and months now. This is that long-term pain or injury that's been happening. That's not what we're gonna focus on today. The next category down will be subacute. Subacute is going to be that intermediate phase where it didn't just happen in the last week or two or recently, but it hasn't been going on for a long enough duration to be considered chronic. And then what we're going to focus on today is the acute phase, okay? And so acute pain or injury is that, you know, you're Monday morning and you rolled your ankle playing basketball on a Saturday or something like that, right? Where it's been a couple days or a couple short weeks here where that injury has persisted, that pain is persisting, and the treatment for that looks different than it would for subacute or chronic injuries, okay? With an acute treatment, our first phase of treatment is going to be decreasing that pain and inflammation. At Health Fit here, we have a wide variety of modalities, things like class 4 laser that help speed up the healing process. We have shockwave therapy, which can help work on the biochemical pathways of pain and inflammation and decreasing those. So that's 2 great modalities to make changes at a cellular level. And then of course we do manual therapy with active release technique. If it's needed, we'll address joint motion and use joint manipulation for that. And so all these different modalities and different forms of care here at Health Fit can help make a well-rounded approach to your treatment and your care with us here. Now with acute care, that first phase being primarily focused on decreasing pain and inflammation, we like to utilize our modalities and our soft tissue work. And then once we're out of that acute phase, after the first couple weeks there, with a higher frequency of visits, we'll move into phase 2. And phase 2 is where we're in that intermediate phase of returning to sport or the activities of daily living there. We'll start to work in some more rehab exercise at that point, some at-home exercise for you that we'll send you. And that's where we start to slowly work back to that normal status. And then phase 3 is where we work on our prevention phase. So this is where, you know, pain and inflammation has decreased. Pain might be totally gone at this point or very minimal. You're returning to sport or activities of daily living with limited limitations going on there. But we want to make sure that this injury or this pain doesn't come back. And so what our frequency looks like in that first phase is going to be a little bit more frequent for a first couple weeks to help get us out of the woods there. And then we're able to taper off on our treatments and change our treatment styles there. You'll see in the later half of this video, we have a different variety of conditions we can treat utilizing the shockwave therapy, the laser, soft tissue work, and adjustments. You'll see kind of a different collage of different ways that we'll utilize that. We have clips of a hamstring strain we treated with shockwave, Achilles tendonitis or Achilles flare-up after a long run on the weekend, and different ways that we'll attack those conditions and make sure that we can get you back to life or sport pain-free fast. So stay tuned here for the second half of this video and you'll see some of those clips and what your care might look like here at Health Fit Chiropractic. All right guys, so as previously discussed, here's shockwave therapy over a hamstring strain there. What that's doing is we're incorporating motion to help get waves into the tissue while the tissue is also working here with some simple leg curls going on there. We're also going to work in some soft tissue work, some Graston here with hamstring curls as well. You can see there to start to see that reaction on the skin there. Here's an example of how we would utilize it with an Achilles injury. So this is post a long run over the weekend, some Achilles pain flare up, utilizing a calf raise with the shockwave therapy, as well as again, some Graston technique over a calf raise there to help implement bringing down that inflammation and pain in the area.